can you get to balance in the budget without addressing some of the, I saw Rick Santorum did an interview recently where they were asking him about earmarks, and he said earmarks are less important than fixing the bigger issues. If you don't reform the entitlement programs, you can't balance the budget.
Yeah. You have to reform the entitlement programs, but we actually had a balance in the first 5 years without doing it by eliminating departments in our budget. The reason is that the savings in Medicare and Social Security, which you have to have, they are driving the deficit, are longer term. So they start kicking in the 5 and 10 and 15-year proposal. Now we have 2 proposals in my office that we're working on. Social Security we can fix and make solvent for 75 years by doing 2 things. We raise the age to 70 gradually, the same way we did in the 80s. We raised it from 65 to 67. We go from 67 to 70 by the year 2030, and then we means test the benefits. And what that means is people who had higher incomes during their working career are going to get less money. Doesn't mean they don't get any money. So for example, if you made over $100,000 a year, I think you get $2,200 a month when you retire. It'd go to $1,900 a month. And most people I talk to, most of them have some other pension if they made more than $100,000 a year, or a savings account, and most of them are willing to accept that. And it would be a way of reforming it and not saying to the person who only gets $600 a month and that's all they get, that you're cutting them. It wouldn't cut them at all, but it would cut the higher wage earners, and it would fix the problem for Social Security. Medicare, kind of the same thing. You need to raise the age, it means test the benefits, but Medicare also needs some market forces, and this is where I agree with Paul Ryan, is that we need to bring the marketplace into Medicare and have competitive bidding. And what we've thought about doing is putting Medicare into the Congressional Health Care Plan. We think immediately people would accept it, because most people think, well, those senators and congressmen, they've made something really great for themselves. And so I think they would accept that more than the Paul Ryan plan was criticized for privatizing, although it would have some of the same aspects. But I think people empirically think, well, Congress has a good plan, it wouldn't be too bad to have everybody on Medicare part of Congress's plan.
So what Ryan talks about doing, and what I think is a proposal recently with Democratic Senator Ron Wyden from Oregon, is a sort of, I think they call it premium support, where essentially instead of paying for your health care, we're giving you, we're supporting your insurance premium. Is that an approach?
It's a little bit of the way we, it's not the pure market approach. The pure market approach would obviously be everything's done privately, but we've come a long way away from that. We've acknowledged that there's going to be this safety net. With our plan, and Ryan's plan I don't believe has been made into legislation. Ours is legislation. We're going to introduce it in January. Ours would have some of the same thing. My health insurance, the taxpayer subsidizes it. I think the government employees pay, I think it's like 20-something% of the cost or whatever. It is subsidized to a certain percentage, and but it's subsidized at a lower percentage than we currently subsidize Medicare, and it's more market oriented. So it wouldn't be perfectly free market, but we think it would bring some market forces to play, and we've estimated that over 10 years it would save about $1.6 trillion.
And when you talk about means testing, would relatively poor seniors also be paying?
It stops at a certain point. So like on Medicare, if you made $500,000 a year, you pay the full cost of your Medicare, maybe even go down to $200,000. And I'm for dropping that down, but it gradually gets less and less. So I think if you made $500,000 a year, your subsidy from the government would be $0. If you made $150,000 a year, it might be your subsidy is 25%. If you made $50,000 a year, your subsidy is getting back to what everybody else gets, which is like 75, 78%, something like that.